Hi. So let's talk about the reversible and irreversible effects of testosterone. So some effects are permanent, right? Those are the irreversible effects. Some are not permanent. So once you stop testosterone, things go back to the way they were before testosterone. Some effects are semi permanent, and we'll get into that later. But so let's go through the list of effects, masculinizing effects, and we'll discuss which ones are reversible and irreversible. So, first, skin oiliness or acne, reversible. So, even when you continually use testosterone, eventually, for some people, it goes away. The skin oiliness and acne, it gets under control. And when you stop testosterone, it'll also go back to the way it was before. Facial hair and body hair growth, uh, those are, I would say, semi-permanent. So what happens to trans guys who stop testosterone? Well, the facial hair is not going to disappear. The body hair is not going to disappear, but it kind of thins out. It's not going to be as thick and long. So it grows slower, but it's still going to be there, right? So I would say it's kind of semi permanent. Scalp hair loss. So if your hairline rises or if you start balding, stopping testosterone will not reverse the effect. What might happen is that you won't continue to bald. Maybe it won't get worse, but your hair is not going to grow back just because you stop testosterone. Okay, so it's important that when it starts happening, you really, really gotta, treat it as soon as possible if you don't want to lose your hair. So one of the most commonly available and easy to use hair growth treatments is minoxidil. Okay. Increased muscle mass or strength, these are reversible. And, you know, once you stop testosterone, you will see a reduction in muscle mass. Even if you continue to work out, you might still see a reduction in muscle mass. Fat redistribution, this is reversible. So if you stop testosterone, your fat redistribution will go back to the way it was before. Cessation of menses, your menses do come back if you stop testosterone. There is a possibility that it won't come back if, let's say, your natural, the function of your ovaries and gonads and whatnot stop because of the testosterone. There's a possibility that it might not come back, but there's also the possibility that it will. Clitoral enlargement, I would say this is kind of permanent, yes. Maybe it will shrink a little bit, but it's not going to go back to the way it was before. And a lot of trans guys experience significant growth. So what's significant? Like an inch or more. So don't expect it to become like really tiny again. Vaginal atrophy, this is reversible. So once you stop testosterone and once your body starts producing estrogen again at normal levels, then you will no longer experience the vaginal dryness, and the atrophy will sort of reverse itself. The deepening of your voice is semi-permanent. They say that your voice, once it goes deep, won't go high again, but it does just a teeny bit, like super teeny bit. So pretty permanent, pretty irreversible. Yeah. So these are definitely things you need to consider. The body odor is reversible. And the joint thing that I mentioned, the creaky joints, also reversible once you stop testosterone. But yes, hopefully you will consider all these things before you decide to go on hormone therapy. Remember, you cannot pick and choose which effects you will have and which you will not have. So it really depends on each individual. Just make sure to, go to your doctor, talk about all the side effects and all the things you can do to prevent certain negative side effects. But for the masculinizing effects, you can't really pick and choose. You can't say, hey doctor, I want a mustache from testosterone, but I don't want the deeper voice. No, you can't do that. By the way, something I didn't mention in the earlier video on hair growth is that if you want a fuller beard, it might be possible with the use of minoxidil, but your mileage will vary. So for some people, minoxidil helps them get like a full beard. But for some people, there's additional growth, but not quite what they want. So again, you can't really choose what you get, no, from both testosterone use and minoxidil use. So that's it. Thank you, and see you again next time.